A 12-year-old client visits the healthcare clinic for a follow-up visit after laboratory and other testing. The client is accompanied by a parent. The client tells the nurse about an increased appetite lately and about urinating more frequently than usual. The nurse reviews the client's test results and collects data from the client prior to the client being seen by the physician. The following is documented in the medical record. So I'm going to read the question now. For each body system, click to select the priority client need to prevent a complication of the client's health problem. Each body system supports one priority client need. Now let's go back to the nurse's note. So we're looking at the patient's vital signs. Temperature of 98.2, heart rate of 78, blood pressure 118/70, respiration 16, oxygen 96 on room air, and the patient reports no pain. Their skin is dry and intact and warm. Respiratory, they have a dry cough. They report sputum and is white and thick mucus following respiratory treatments. Their lung sounds are clear when you're listening to them. GI, they have an increased appetite. They report taking pancreatic enzymes with all meals and snacks, and their bowel signs are active, times 4 quadrants. Regular bowel movements, they are brown and fatty, and their weight is 41.5 kgs. Height is 59 inches, and the patient states that the client was diagnosed at 3 years old with cystic fibrosis. So, take a break, because guess what? That was a lie. All right, so now we're going to go back to the question. So let's read the question. It says, for each body system, click to select the priority client need to prevent a complication of the client's health problem. Each body system supports one priority need. So we're going to go through each body system and which is priority. That means which one is most important. So in our respiratory, it says an oscillatory positive exploratory therapy or oxygen administration. So let's think about it. Which one are we going to choose? So we know that for sure this patient is dealing with cystic fibrosis. So did you pick that out as a key thing that you need to remember? That this patient has cystic fibrosis. So you can then go back under the tab of respiratory and see what's going on in that respiratory with the patient's respiratory system. So that patient has a dry cough and that patient has some white mucus coming up, white thick mucus coming up, but that patient oxygen is 96%. So does that patient need oxygen if they're 96 on room air? No. But could the patient benefit from a PEEP therapy if they are having white thick mucus? Yes. So what is a oxidatory positive expiratory therapy? That is a little machine we can give the patient to blow in and breathe in so that they're able to mobilize those secretions. So we want to mobilize those secretions so that patient can be free of mucus. So you see how important it is not to know what cystic fibrosis is, but it's also to know what your oscillatory positive expiratory therapy is. Because if we didn't know what that was, we wouldn't have been able to answer this question. All right? But we would have been able to with the process of elimination, knowing that this patient did not need any oxygen because they're 96 at room air. Let's go to the next body system, GI. So we look in the GI section in our nurse's notes. It says that the patient has an increased appetite and reports taking pancreatic enzymes with all meals and snacks. Bowel sounds are active, and they have regular bowel movements that are brown and that are fatty. So which is priority? A low-fat diet or pancreatic enzyme therapy? Let's think about it. So this patient has cystic fibrosis, meaning that they do not have those pancreatic enzymes that they need to for digestion and for absorption of nutrients. So a patient needs to always take their pancreatic enzymes. Those are very, very important. So that's going to be priority for this patient. So the diet for our cystic fibrosis patients, we're going to want them to have a high protein, high calorie diet. And guess what? Their fats are going to be unrestricted because of the impaired intestinal absorption. So this goes to let you know that, guess what, diets are very important. Diets are very important. But in this problem, you need to know that pancreatic enzymes are important. So important. All right, so let's move to the immune system. All right, so would you start the patient on antibiotics just prophylactically? Or would you put the patient on contact precautions with separations from other CF, cystic fibrosis patients, by at least 6 feet? All right, so we're reading through the nurse's note. We look at the diagnostic test, and it says that the chest x-ray just showed mild lung hyperinflation, no chest infiltrates, no atelectasis. So why would they need to be on an antibiotic? Let's make sure we're crossing all our T's, and we're going to skim through the rest of the problem. But nothing says that this patient needs to be on antibiotics, right? And we don't want to put patients who are chronically ill, we don't want to be putting them on antibiotics for just any type of reason, because guess what? They will build up resistance until when they need an antibiotic, it's not going to work. So one of the biggest things with our cystic fibrosis patients is making sure that they are free of infections. So we want to make sure that we're teaching their family and teaching the patients how to prevent infections. So if they are in contact with another child who has cystic fibrosis, we want to make sure that that child is not sick, because we don't want to cause a cross infection. So when they are around another child with cystic fibrosis, we want to make sure that there are contact precautions in place, because we don't want there to be cross infection. And it's not that we that these patients don't need to be around other CF patients or their friends, but also, like I said, you need to be teaching them infection prevention at all costs. So this patient may wear masks everywhere they go to prevent infection. So infection prevention is so important in this patient population. All right, so let's move on to our endocrine system. So it says insulin administration, or we could have a human growth hormone administration. All right, so let's look at our diagnostic test. So we see that the patient has a glucose of 240 mgs per DL. So, and that was 2 hours after administration of a glucose liquid. So 2 hours, and their blood sugar is still pretty elevated to say it was 2 hours ago. So patients who have CF are at risk for CF-related diabetes. So we looked at our blood sugar level, and our blood sugar level is high. So guess what? Insulin administration would be appropriate in this setting. All right, so the final part of this question is the integumentary system. All right, so it says that would you do high sodium foods or oatmeal baths? So we're going to check our nurse's notes, and the only thing that we see on the skin is that the patient's skin is warm, dry, and intact. All right, so it doesn't give any details on there, but we know that when we're dealing with cystic fibrotic patients, that these are our salty patients, that these are our salty kids, where we're going to taste a salty kiss from them. So these patients excrete a lot of sodium and chloride in their sweat. So we want to make sure that we're giving them foods that's high in sodium to keep up with what they have pushed out. So you see how it is so important that you have an understanding of different disease process, because you see how they dig so deep into this this question. And if we didn't know anything about cystic fibrosis, we would not have been able to answer this question successfully. So this question is just a reminder of how deep this Nclex wants you to be able to think. So you need to make sure that you are reading and understanding your disease processes. You cannot memorize anything. You have to be able to understand how these disease processes work in order to answer these Nclex questions.